Evening, students. This is Miss Lamport. I'm going to talk with you today about doing a subcutaneous injection. What I'd like to do is review all the parts of the needle and the syringe as a review. Okay, so in this particular case, we actually have a separate 3cc syringe and a 25 gauge 5/8 inch needle that we're going to attach onto this lure lock. I'm going to show you the parts of the syringe and the needle. We went over them in the last video. We're going to go over them again. All right? So we have now this one is a 3cc. The last one that I taught you from was a 1cc. This is a 3cc hypodermic needle. All right? So we're going to talk about the parts again. This part right here is your plunger with the little round end on it. These two finger parts right here are called the flange. You use that to hold and then push your medicine in with your thumb. Then you have the rubber stopper that's actually inside. It has 2 layers, and then when you're measuring your amounts, you want to measure it at the top layer. And then you have your calibrated barrel. Your calibrated barrel is the numbers of the amount of fluid that's in here. This one actually goes from 1/2 or 0.5 cc's down to 3 cc's. Then you have your lure lock tip, and the lure lock tip is where you're going to attach the needle. Then with the needle, this one actually comes in its own separate package, and the way that I prefer you to do that is to just open it down like that, then take your syringe and lock it in like that, okay? And again, you have your safety. The orange part that you can see right here, I'm going to remove this so you can see it better. This orange part is the hub. I'm going to reattach it, screw it on good. Pull this cap off away from you, not up like this so you won't get stuck. And you see that white portion on there, again, is called the hilt. Then you have the shaft of your needle. Then you also have the cutout portion, which is called the bevel. And then inside of the bevel is the lumen and the gauge. And of course, you have the point. When they sliced it, they made a point so that it would stick into the patient easily. And remember, if you're going to put a needle back into its cap, always lay it down and do the one-hand scoop method. Don't do like I just did and put her hand on, because you could stick yourself with it. Okay? All right, so the items that we're going to need today to do the subcutaneous injection is a pair of gloves, your solution, and remember, when you have a new vial of solution, you pop the top off, you put your initials, first initial, last name, the date, time, and put /SMA. That's your title. You're a student medical assistant, all right? Then you need your needle and syringe. We're using a 25 gauge 5/8 inch needle on this particular injection. You need your cotton balls, and you need the alcohol prep. Now you need 2 alcohol preps because you need to wipe off the top of your vial, and you'll also need to prepare the patient's site. Okay, so we're going to open the alcohol prep, and we're going to take it, and we're going in a circular motion. We're going to clean off the top of our medication vial, and we're going to let that dry. While that's drying, I'm going to go ahead and apply my gloves. Would be nice if I know what finger went in which opening. Okay. All right, so then I'm going to apply my other glove. Okay. All right. Then I'm going to go ahead and, with all medications that you draw up what the doctor has ordered, what the amount is that he or she is asking and requesting you to give. So we're going to give on this one a 0.5. Okay, some of these syringes say 1/2, but 1/2 is equal to 0.5 mLs as well. So we're going to put it back and put the top of our plunger right at the 0.5 or the half mark. And then we're going to remove our cap. And then I prefer you leave the vial laying down or sitting down so that you don't stick yourself. Then you're going to take and you're going to put your needle into your vial, and you're going to turn it up, and you're going to hold it whatever way is best for you, but this is the best way I found that I get a good secure on the vial as well as my syringe, and I'm going to push that medicine in, and you can actually see the air, push the air in, you can actually see the bubbles that come in when you do that. But you always want to put the same amount of air in the vial for the medicine that you remove, okay? Then you're going to take and you're going to pull down on your plunger. And I always suggest you go a little bit more than what you're asking for, because that way you get all of the medicine and all out of the air, all out of the hilt and the hub part of that and the needle. Now, I have a bubble, but I also have more medication than I need. So I can flick that bubble, and then I can push my medication up, and that bubble, in this case, it went out. So I'm checking my needle and my syringe, and I found a small little bubble right here. So I want to tap that bubble out, because remember the last time when I was speaking, I told you that a bubble in a syringe can cause a cardiovascular accident. It can also cause a cerebrovascular accident, or it can cause a heart attack, or we call that a myocardial infarction, or it can cause a pulmonary embolism because someone already has a blocked artery. So once you get all of your bubbles out and make sure that they all are out of your syringe, then you take your syringe out and you put it in with the one hand scoop method, and then you're ready to go and go to the room where your patient is at, right? So when you get to the patient's room, good afternoon, Miss Jones. The doctor has asked me to give you an injection today. Can I verify your name and your date of birth? She's going to give you her name and her date of birth. And then you're going to ask her, does she have any known drug allergies? And if she doesn't, or if what you're giving her is not one of the allergies, then you're going to proceed to ask her, can she wait 20 to 30 minutes after the injection to make sure that she doesn't have an allergic reaction? Very important to get that information from your patient so that you can find out, because you wouldn't want to give them medication that they had an allergy to. And you say, well, maybe they don't know. That's the 20 to 30 minute wait after the injection time to see if she develops an allergic reaction to this medicine, okay? So we're going to do this. There's several places to do your subcutaneous injections. One is on the back of your arms, one is on your abdomen and area, and one is there's spaces on your back. We're using the one that's on the back of the arm. So you see the person's elbow. So you're actually going to place your palm portion of your hand on that elbow part, and you're going to swing around like that, and you're going to pinch. So you're going to pinch that skin, and then you're going to get an alcohol prep. Okay. Pinch. So we can pinch on this one. You're going to clean in a circular motion about 2 inches out away from the actual site, because we want to remove all of the bacteria and the microorganisms that might be on the area. Place your cotton ball here so that when you're ready to use it, you can put it on the site. You want to make sure that your bevel is always facing up. And usually when your bevel is facing up, your safety is to the right side of the syringe. Now, we're doing an injection that is a subcutaneous injection that must be done at a 45-degree angle. This is your 90-degree angle for your intramuscular injections, but subcutaneous are given at 45 degrees, except insulin and heparin, because those use a different type of needle, very small, even smaller than this. It's like a 3/8 inch. So for your insulin and your heparin, it's called a subcutaneous injection, but you actually give it at a 90-degree angle, okay? This one can be done for MMRs and different items like that as well. So you're pinching the skin up really good. I like to see you hold it like this, because it just seems natural with it like that to go up, and it gets the angle very easily, okay? So once it's dry and the patient you ask the patient, they say yes, you pinch the skin very tight and you hold it like that, then go halfway. And this is important that you go in quick on these injections, not slow. If you go in slow, you're going to hurt your patient. So you want to go in quick, then you want to come back here, and you want to take and pull back on your plunger just a little bit to see if you've got any bubble that comes in. You don't see any bubble, then you take this hand free, come here, push your medicine in slowly. Then you place your cotton ball right there, but don't press on it, and come out quickly with your needle. Ask your patient to apply pressure here for you, and then you go ahead and take your safety on your needle. I don't like to see you use your hand. Put it on a surface, snap it in. You can hear that little snap, and immediately put it in your sharps container. All right, so then you check and see if it's bleeding. If it is, the patient may need a Band-Aid. If it's not bleeding, then you can ask the patient, do they want a Band-Aid even though it's not bleeding. And if it is bleeding, of course, then you want to place a Band-Aid on it. Okay? So that's the instructions and the directions on how to give a subcutaneous injection. This one in the fatty part, and that's where you're giving it, is in that third layer of your skin. You have an epidermis, a dermis, and then a fatty layer called the subcutaneous layer, and that's where we want to give this medication. And this medication given subcutaneously is for medications that are needed to absorb slowly throughout the whole system. Okay, so they need to be given in that subcutaneous layer to be absorbed slowly. They're thinner solutions, smaller amounts, and they go into your subcutaneous layer of your skin, which again is the third layer, which we call it the fatty layer. And it is a fatty layer because it has a fatty tissue for insulation and for protection. Okay, so that's your instructions on how to give a subcutaneous injection in the back portion of the subcutaneous fatty tissue in the back of the arm. If you have any questions, again, you can always send me an email, or you can text me, or you can get in contact with me, either one of those two ways, and I'll be glad to answer any questions that you may have about giving subcutaneous injections. Okay, that's all. Thank you, and I'll see you next time. Bye.